Here's the top 5 worst hair transplants ever. Wayne Rooney, Joe Swash and Gordon Ramsay have all had theirs done. But trying to save cash on a hair transplant can leave you disfigured and even scarred for life. Experts are warning, if you have a weak stomach out and watch this, and I would look away now. Unqualified taxi cab drivers and Syrian refugees are doing operations on UK Brits posing as hair transplant surgeons. Their experts warn that illegal black market pirate clinics are putting people at serious risk.
At number 5 we have overharvested results, which results in men being left with huge bald spots where the donor area was operated. Overharvesting happens when surgeons overestimate the number of grafts needed for a successful hair transplant. They extract too many follicles from the back of your head, leading to unnecessary scarring, patchy growth, and insufficient follicles for follow-up procedures. Experts say surgeons shouldn't remove more than 1 in 4 follicular units for a hair transplant. At number 4 we have improper hairline design and placement. This is when the doctor implements the hairline with bad design, improper direction, and unnatural spacing, leaving the poor patient with an unnatural or botched hairline. This can result in the patient having to live the rest of their life with awful hair placements on their face. The surgery that removes implanted hairs is near impossible, making these unfortunate results extremely difficult to undo. At number 3 we have multiple scars from punches being too big or too close together, resulting in scars becoming visible and the hairs not being able to grow back in the area they were harvested from. This is irreversible and there is no way of fixing this, as the scarred scalp will not fully recover and let the hair grow through it again. This has left patients practically bald in areas as the scarring is so prominent from the so-called doctors being too rough and not careful enough with the unfortunate patients.
At number 2 we have recipient area necrosis. You would think this was number 1, but it gets worse than this. Area necrosis is when the scalp practically gives up on the patient and it starts to die. Recipient area necrosis is a rare but dangerous complication that arises when an increased number of recipient grafts are utilized and devascularization of the scalp occurs as a result of dense splitting of recipient skin that results in large wound areas. This usually happens when the surgery or doctor isn't clean and infection has been able to get inside the patient's bloodstream. Are you sure you're ready for number 1? In place number 1 we have using outdated hair transplant techniques and methods. This is definitely the worst thing to happen to anyone while getting a hair transplant. The oldest and most outdated method has to be the 4mm punch excision, which was practiced in the 1960s. In this procedure, doctors would literally punch a 4mm hole from the patient's skull and implant it in the place of balding. This left hundreds of men in the 1960s with doll-like hair because the transplants were so bad they were compared to doll hair, and I'm sure you can see where this name came from. This operation is irreversible and put people off getting hair transplant procedures for years and years until modern-day technology came around.